Hypertension Awareness Series Episode 7, Isolated Systolic Hypertension, or what I will be calling ISH, when only the top number is high. Let me start with a question that has been asked by John Mwagi and also asked by many others in this awareness series. John Mwagi asked, Doctor, if the BP is 151/62 in someone over 60 years, is that high or low? And should we be worried? And this is an important question. So if you are worried about the top number being high, please keep listening because we are addressing that today. In our setup, it's very common to hear, ni pressure ya uzee. No need to get worried. There is nothing like pressure ya uzee. This is a common and silent threat in older adults and a major cause of stroke and heart failure. Many people are told that your top number is high, but the lower one is okay. And this is the condition that we call isolated systolic hypertension, or ISH. And it is the most common form of hypertension in adults over 60 years. Yet it is underestimated and also undertreated. So what is isolated systolic hypertension? Isolated systolic hypertension is diagnosed when the systolic BP, or the top number, is more than 140, and the diastolic BP, the bottom number, is less than 90. For example, 160/68, or in John's case, 151/62. That is isolated systolic hypertension. Even if the lower number looks normal, the high systolic pressure alone is dangerous and is strongly linked to complications. So why does ISH happen? The main problem is arterial stiffness. As we age, the large arteries like the aorta become less elastic, they get thicker and stiffer, and they are unable to cushion the pressure from each heartbeat. This causes a higher systolic pressure and a lower or normal diastolic pressure, isolated systolic hypertension. What are the other contributing factors? This also occurs with long-standing and controlled hypertension, in diabetes, in chronic kidney disease, in people who smoke or have a high salt intake, and also sedentary lifestyle. So, isolated systolic hypertension is not just old age. It reflects vascular aging and cumulative lifestyle exposure. So why is ISH dangerous? High systolic pressure puts direct strain on the vital organs. It leads to stroke and transient ischemic attacks, heart failure, especially heart failure with preserved ejection fraction. It causes the thickening of the heart muscle, cognitive decline, and also dementia in the elderly, and obviously leads to kidney damage. Studies show that systolic BP is the strongest predictor of cardiovascular events in older adults. So remember, systolic BP is the strongest indicator of cardiovascular risk in elderly adults. So how do we treat isolated systolic hypertension? Treatment is very effective and greatly reduces the risk of stroke, heart failure. According to the hypertension guidelines, the options for treatment for isolated systolic hypertension include thiazide-type diuretics, things like chlorothalidone, idapamide, or hydrochlorothiazides, long-acting calcium channel blockers, CCBs. Remember, long-acting, like amlodipine. If you must use nifedipine, it should be nifedipine LA, the 30 mg. And really, you can add on your ACEs or ARBs. But the key is thiazide-type diuretics and long-acting CCBs. Remember your BP targets in the elderly, BPs of below 140/90, but you must not lower your BPs too low because of the risks of dizziness and falls in the elderly. So in the elderly, treatment must always be individualized, especially in frail older adults. Remember, as is always the case, lifestyle still matters. Even with medication, lifestyle is important. Cut down the salt, eat a healthy diet, regular gentle exercises. Even with elderly, exercise is important. Healthy weight, no smoking, no alcohol. All these improve the overall health. And for treatment, thiazide-like diuretics and long-acting calcium channel blockers, plus minus your ACEs, ARBs. So what can you do today? Check both numbers. Don't just ignore one. If you have high systolic readings, they still need to be treated. Remember, as always, home BP monitoring. Take your medication as prescribed. There is nothing like pressure ya uzee. Know your targets with your doctor. And to the healthcare providers, remember to treat isolated systolic hypertension. Let me conclude by saying this very clearly. Isolated systolic hypertension is not innocent. It needs to be treated. We have said systolic blood pressure is the greatest marker of cardiovascular risk in the elderly. With proper treatment, healthy habits, and regular follow-up, many elderly people will live full, active, meaningful lives. Caring for your blood pressure is not just adding years into your life. It's adding life into your years. Stay tuned to one of the most important episodes in this series, episode 8A and 8B, where we will learn how to measure blood pressure correctly. We have been saying blood pressure over 140/90. So in episode 8A, we learn how to measure BP correctly. 8B, we learn about the common mistakes we make in measuring blood pressure. Please share this episode to help someone learn about isolated systolic hypertension, the commonest form of hypertension in the elderly. As always, Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.